Morning, everyone. Thank you all for coming. We know it's pre 9 o'clock, but given that you all have quite busy days, we thought it may be best to do it before that starts. So the purpose of today is really to begin a discussion around some of the key challenges that you all face within social care. I myself, from a different perspective, have faced them in my previous role when I was a nursing home manager, so more frontline. But certainly, I can relate to the challenges that you all face in terms of workforce retention, development, and those issues. So we've got two brilliant speakers today, and we've got Simon, who's an experienced DAS, who's been doing some brilliant work at Halton at the moment, and we'll be moving on soon to do some more brilliant work elsewhere. And we've also got Elaine, who is also director level, and she's going to be offering her opinion from the provider perspective as well. So the format for today's breakfast briefing will be as follows. What we're going to do, we're going to introduce Simon properly in a second, and then Simon will take over. He will present, and following that, Elaine will present. Both presentations will be probably around 10 minutes, and we'd ask that you hold any questions to the end, so that we can, go through that discussion, open up to the room, and then, hold your questions to then, and we can get them presented. Again, at the end, it would be what we're going to do. We're going to share a little poll round afterwards so that we can get some feedback on this, what worked well, what could work better. The idea is that we create sort of a long running format and forum really for everyone to have a conversation, bring fresh ideas in, and we'll host, given that you're all quite busy in your day-to-day lives. So it's about us really giving something a little bit back rather than just the recruitment. So without further ado, I'll pass over to Simon.
Thanks, River. So good morning, everybody. Is the presentation? Perfect. Super. Thanks very much. It's really good to be here with everybody today. This is a subject that's close to my heart, and I'm sure it touches on everybody in various different ways. And it's very often in the news at the moment, and I'll come on to how I think it's perceived through the news and the kind of narrative, public narrative there is around this, and how that's not always so helpful. So if we move on to the next slide, shall I just say who I am and what I've done? Because so I'm Simon Gałczyński. I'm a social worker by background. I'm still a registered social worker. I've done various roles in social work fieldwork. I've done roles across the NHS and local authority. And as Riv was saying, I've been a DAS. I'm now doing some consultancy work, which I'm finding really interesting because it gives you a chance to go around lots of different parts of the country and see what's working and take lots of ideas around and share them around with different places. With regards to recruitment and retention, at the moment, we've got a perfect storm of issues impacting on recruitment and retention. And I'm mainly going to be looking at this through the lens of social work and care workers, because that's mainly my world, and I've only got 10 minutes to do this. And I'm not going to even attempt to solve the whole of recruitment and retention in those 10 minutes. But that's really impacting on all aspects of social care, from qualified social workers, more advanced social workers, where we need specific skills, for example, for approved mental health professionals, occupational therapists and other allied health professionals, and staff providing direct care, so care workers. And it's exacerbated massively by the financial situation in councils. So we heard about Birmingham last week. We don't think that Birmingham is going to be the last to be in such difficult financial situation. But I think even in councils that are managing to balance things at the moment, people will be hearing about funding, and the fact that over the last so many years, funding's been on an annual basis. So workforce planning has been much more complicated in that context. CQC assurance, so Care Quality Commission assurance, that's already just started in local authorities. From the feedback we've had so far, there seems to be a particular emphasis on looking at waiting times for assessment. And obviously waiting times for assessment assessment is closely linked to recruitment and retention, because if you don't have the staff, or you don't have the staff in the right place doing the right things, then that impacts on the amount of time that people have to wait. So I think it's put recruitment and retention even more in the spotlight, and hopefully that will be done in a helpful way. So as I said, I'm going to focus on social work and care staff, but I appreciate that that's not the whole world of social care. There's a lot more to it than that. Okay. So next slide. So, waiting lists, so people waiting longer, not good, due to lack of staff. So either longer for services or longer for assessment. People will deteriorate. People will have higher needs by the time they receive a service. And also it just produces less confidence in the system as a whole. Social care, this is what I was saying about the kind of news stories. So the news stories about social care are always about hospital discharge delays. And it's really important that people leave hospital when they're ready to leave hospital, but that's only part of what social care does. The needs of younger adults that are supported in the community and the budgetary impact of that group is fast catching up to the needs of older people leaving hospital. Only 1 in 4 people referred to social care actually comes from a hospital discharge. So hospital discharge is important, but it's not the only the only pressure on social care. It's not the only route in. But it's the route that tends to attract the most funding, because it's headline news, and that's the perception that people often have of the job that social care is doing. So I hope that makes sense. So social care, I'm not saying hospital discharge is not important. It is important, but there's a lot more to social care than hospital discharge. That's one part of the jigsaw. And I think I've left it last, but I think it's really important that care work, so the majority, apart from unpaid carers, the majority of work undertaken in social care is undertaken by care workers. They are invaluable. It's often seen as a job rather than a profession, and I'm really keen to look at how we can professionalize care work, and give that job, that profession, the status and value that it really deserves. Okay, next slide. So how do we approach this? So there isn't a magic bullet, and there isn't a one-size-fits-all approach, because we have to take into account different local circumstances. There'll be different employment situations, rural isolation in some areas, for example, impacts on how we recruit and deliver care. But I've really just putting in some observations and experience of what I've seen that's worked or people are working on at the moment to improve the situation. And I've tried to pick out what I think are some of the key themes through things that do work in improving the situation. And I've pulled those out as being partnership. So partnership between local authorities, providers, the NHS. So I know we talk about the NHS as one big amorphous body, but I mean the NHS in all of its components. So it's integrated care boards, primary care, secondary care providers, and so on. And really importantly, the voluntary and community sector. Really important to have a culture of trust, openness, and communication. It's really important to look at how we effectively deploy staff and streamline processes. So have we got people in the right places doing the right things? And lastly, it's not all about money. So recruitment and retention is not just about paying people more. Money is an important part of it, but people choose to stay and develop their careers with an employer for a number of reasons. Okay. So partnership. So this happens at different levels. So at a local or place level, as we refer to them now, regional levels. So the regional ADAS groups have been doing a lot of work around recruitment and retention, and at integrated care system level. So just some examples really within this space. So joint working with the NHS. So in North East Lincolnshire, we worked with, where I was interim DAS for a while, we worked really closely between the Integrated Care Board at place and the local authority to commission care agencies to undertake both health and social care tasks. So really close partnership with care agencies. It made better use in terms of resources because we were commissioning together for a single service. Much better experience for people using that service because they had one person coming in to do a variety of tasks rather than lots of people coming in and out of their home to do different tasks. And I think really importantly, for staff, it was really important because for care staff, it enabled them to start to develop and grow their skills. So rather than coming into a social care work role, and just doing that day in, day out, they were able to start developing the skills under the right supervision of clinical staff and so on. So, and the evaluation of the impact of that was it saved money, better experience for people, and actually it meant we had a staff group who were much better able to spot things. So because they had both the health background and the social care background, they were able to escalate things more quickly when something looked like it wasn't quite right or needed further intervention. Recruitment. So I always like to put this into the wider economic agenda for the local area. So local authorities and NHS organisations are massive employers in their local area, and particularly for area, the times we're in now and the situation that the areas of higher deprivation are in, supporting people into careers in employment in health and social care is really important. So again, I've done this in a number of places, but working really closely with the DWP, working with care providers, with the NHS, with council employment services to support things like employment fairs. So I was outside the town hall in Grimsby where we were running an employment fair. There was somebody hovering outside. I had a chat with her. She said, I'm working in a factory at the moment. I want to do something more rewarding. And I kind of said, come in. And then introduced her straight away to one of the care agencies it's really just supporting people to just to find out what it's about and get people energized and excited about it. And doing a lot of work in terms of outreach to schools and colleges as well around careers in social care. If we can do that jointly with the NHS, it's even more powerful. So the one we did in Grimsby was a joint employment fair with the NHS, and working with the voluntary sector, really important. So I think a lot of you already will be familiar with the voluntary sector, supporting people with lower levels of need coming out of hospital. So people that are on pathway zero, which always sounds a bit too clinical to me, but people who just need a bit of shopping, a bit of settling in back home. Actually, the voluntary sector are much better at doing that than social workers and NHS staff. Using the voluntary sector, working with them at the things they're really good at, much better use of staff and resources. Okay, so culture. I think we've had a culture of competition. So we've tended to put agencies, providers up for competition against each other for contracts. And I think there's been a bit of a history of competition to reduce the cost of provision as budgets shrink over the last 20 years or so. And I think we've seen some of the results of that in terms of the very low margins that providers are running on now and the impact on retention. The fair cost of care exercise was an attempt to try and remedy that. I'm not sure whether the fair cost of care exercise, for those of you that were involved in that, really got to the point where we arrived at a figure we could rely on as the indicative figure for a sustainable market. What I did think it did was encourage more of an open book approach with providers. So it encouraged that openness of discussion that's needed between providers and commissioners for a sustainable market. So a much more collaborative approach, one around communication, rather than a more kind of monolithic approach from the local authority in terms of putting out tenders and not having those discussions, interactions with providers. And just an example of collaboration. So last winter, time of extreme pressure on providers, care providers, small pots of money available to support people and support the market through the winter. I think rather than just assuming from the NHS and the local authority about what was needed, it was, I just saw a note there about the fair cost of care. Yes, significant lack of funding, true. So yes, rather than just assuming what providers needed, we worked with them, particularly home care providers. And the things that people told us would make a difference, the things that agencies told us would make a difference and their staff told us would make a difference, weren't the things we thought. They told us that one of the key things was support with childcare, transport. They wanted to try, some of their care work staff wanted to try electric bikes. So we gave some electric bikes for people to try. Retention bonuses. So again, people weren't talking about massive amounts of money. We put in retention bonuses of about £300. So anybody who was employed at the beginning of December, who was still there at the end of March, would get a retention bonus. And that was enough to make a difference to people without impacting on any other benefits or tax incentives that they had. So there were some quite small things that actually made quite a fundamental difference in being able to continue to ensure supply of provision over winter. And jumping onto social work, I think the best example of the grow your own approach to social work I've seen is in Halton, where I'm working at the moment, where they've now, I think they've got one permanent social work vacancy in adult social care. It's a culture that really embraces and supports students. They've really maxed out the apprenticeship approach. So they've got about, I think, 7 apprentices at the moment in adult social care for a very small local authority, population of about 120,000. I think that's fantastic. And that ongoing culture of learning, development, and support, that upfront investment from people has really paid off in terms of people having a really good experience as a student there, employing for a permanent position there. And I'm speaking to people sort of 20 years later who are there as senior managers who developed their career there, not because they don't have anywhere else to go. There are loads of neighbouring authorities they could go to, but because of that culture, that support and experience, which leads me on to the next slide. No, it doesn't. It's all after that. Sorry. So effective deployment of staff. So sorry, it sounded a bit like sending troops out to battle. So how do we work with people effectively? How do we work with staff effectively to keep them engaged, interested, and working, doing the right things in the right place? One of the key things for me is actually engaging with staff as well as the people who use services in the development of new ways of working. So examples of that work that I've done around developing strength-based practice. Within agreed parameters, I actually allowed frontline staff to develop that themselves, to lead the development of that. I provided project management support. We had check-in meetings every week. We did a sprint approach. That really got the energy, engagement, and involvement, and again lent that to that culture of people feeling that their voice was important, and they actually played a key role in strategic development as well as the key work they did on the ground. Similar thing around multidisciplinary working. I'm conscious of time, so I'll speed up. And then gatekeeping. We've had a tradition, I think, in social care and councils of putting people through lots of processes, from call centres through to access teams, through to until they get to the right person. I think we need to start turning that on its head. What I've seen working really well is the development of wellbeing services. So rather than people going through waiting 4 weeks for an assessment, then being told they don't meet eligibility for statutory services, and then being referred on to a voluntary sector service, actually working with people up front with a mixture of social care staff, healthcare staff, and the voluntary sector, and public health, really importantly, to provide these kind of preventative universal services for people. Single point of access, really important as well. So again, rather than people going through a call centre and then gradually getting escalated up to people with more experience, putting that experience up front. I saw that work really well in Bracknell Forest, where they had nurses, allied health professionals, social workers, making sure people are on the right pathway. Okay, I'll move through the next few really quickly. So not just about money. I've said a lot of this already. Social workers don't just choose to stay with the council for money, and I think the same goes for care workers. We need to work both at a local level and at a regional level. Councils need to make sure they don't do anything to destabilise the market in neighbouring authorities. So how much they pay people, for example, the conditions they offer, they need to be aligned. Otherwise, we end up with a competitive situation, which doesn't particularly help. I think integrated care systems, fantastic opportunity to develop a comprehensive workforce strategy. I think they'll be in different places in different areas of the country as they settle into a new way of working. But you know, significant opportunity there if we get that right. Okay, and next one. So summary. That was a very brief overview of some of the elements that I think can support recruitment and retention within a challenging context. There's a lot more to it, but I'm conscious of time and welcome discussion about that. Just some things to leave you to think about. Overseas recruitment, I didn't talk about, so that's something that's happening. Occupational therapy and other allied health professionals in demand. Not enough time to talk about that, but really important. And also direct recruitment of care staff by NHS trusts, which is happening in parts of the country as well. So I hope that wasn't bombarding you with too much too quickly, but thank you very much, and I hope that was helpful.
Brilliant. Thank you very much, Simon. That was really informative. Really appreciate that. Like you said, you know, it's hard to get it all in in a short space of time, but it's a great start, that's for sure. So we'll move on quickly now to our next speaker. So Elaine Woodward has been working within mental health, substance misuse, amongst other roles for 30 years now. She's vastly experienced, and one thing she's developed in many of her roles is the workforce. So I'll hand over to Elaine, who can carry on my introduction and probably speak about her own background in a bit more detail than I can.
Yeah, fine. Yeah, Elaine Woodward, I am a registered social worker, and I've worked in commissioning in local authorities and the NHS. And my current role, I work in a mental health trust in the social care directorate, and taking the lead for social care workforce. Some of the things I've introduced have been the apprenticeship scheme, and I'm also the lead for the Think Ahead programme, which is a fast-track graduate programme to recruit mental health social workers, and also involved in the multi-professional approved clinician, where social workers and other professionals can become really highly paid frontline clinicians. But yeah, and if anybody wants any information on that, just ask me at the end. Yeah, next slide, please. Thanks. So the data set, I'm not going to bombard you about, was a commissioner, so I'm interested in this. So the social care sector is one of the largest health and social care employers in England. But we are aware that although in a vast number, and the number of posts needed, but also vacancies, is also increasing and year by year. According to the data, the total number of was 1.635 million. So that's more than the NHS schools, food and manufacturing. I think people aren't aware of that. People know that the NHS is probably the third biggest employer worldwide, but actually social care posts are even larger in its widest sense. But then we do have vacancies. I think we all know about the vacancies rates, and it can be as much as 10% vacancy rate up and down the country. I'm telling you things you probably already know, but there's some, you know, really stark statistics that we can't ignore there, but you can read that for yourself. And what's the impact of this? So in a few weeks ago, the BBC asked the 203 local authorities about their average waiting time for initial assessments. Sadly, only 78 replied, but 40% had an average wait for 3 weeks, but some had, you know, months and if not years waiting for assessments and packages of care, which for some people actually meant that they died before they had their package of care assessed or implemented. I think we all know, those who've worked in local authorities, that actually private companies are now handing back contracts year on year because of they can't get staff, and also, as mentioned in Simon's, the value for money, they can't actually make ends meet. And one of the biggest reasons that they handed staffing their contracts back was not only the financial, but just trying to get staff who were interested in the work, qualified, whatever. So 74% of staffing was the main reasons. And so these figures show just how important it is that we do get our staffing levels right, and the impact of workforce on the adult social care system. Next slide, please. So lots of vacancies, and with that, we're aware that not that we just work with older adults, but life expectancy is due to increase by 13 years over the forthcoming years. So the demand is going to rise, grow and grow and grow. So what do we do about that? Including the older adults, our more vulnerable members of the community will continue to grow and grow and put more strain on our social care workforce and social care providers. So we're saying there's going to be a lot of vacancies, and a shortfall of vacancies of over 250,000. Yeah, I don't want to bombard you too much with stats, but I do find it quite interesting. And you're probably all aware that the NHS submitted their long-term plan on the 30th of June of this year. Although it was focused on the NHS, they do acknowledge that we need to work on social care, but what we're really keen to emphasise is that although they need to grow their workforce, they don't want it to be at the cost of social care. Though we do know those who've worked in both, that for loss of staff, it's often seen as better kudos to work for the NHS, even for unqualified staff, the pay and conditions, and also the status, that we do have to be careful that as the NHS works to improve their workforce, that it isn't at the cost of social care. So yeah, next slide, please. So I'm not going to go into great detail, but anybody who's developing a workforce plan, I think it's worth looking at how the NHS workforce plan structured theirs. I've recently developed a social work strategy for our partnership, and I use these 3 headings. So there's a need to train, retain and reform. So the apprenticeships are a great route in. There's more to it than that. I'm the operational lead for Think Ahead, which is a government-run scheme, and I know it's similar to the one in social care for children and families. But training is incredibly important, and it gives staff, they feel valued if they get a good training package. So training, so if you're developing plans, really look at your training needs, and Skills for Care will fund you. There's so much free funding available and free training around. If you've got the time, tap into the Skills for Care website, which will give you lots of ideas and access to funding. But it's not just about training and getting new people in, it's retaining them. It's really important that we keep our staff, keep them motivated. So retaining is really important, but just as important as that is the need to reform. So improving productivity is really important as well. So these, as the NHS, and I really believe these are the 3 main focus if we want to improve our workforce, both in terms of quantity and quality. Next slide, please. So productivity, I think we all know, looking at in whatever area of work, whether that's manufacturing or social care, that our workers just aren't working as effective as they should be. There's lots and lots of reasons, but one of them can, and especially as I'm in a mental health trust, I'm well aware of the importance of tackling workplace stress and really looking at mental health well-being. But you're probably all aware of presenteeism as well. I've done quite a lot of work, used to be a mental health first aider trainer, so working with a wide range of companies who were outside health and social care. And as it's more and more difficult, as we more and more scrutiny when people take time off work for being ill, what we do find is people come to work, but they're not maybe ill, may have lots of issues. So they're physically at work, but they're not productive. It's what we call presenteeism. And the impact of people being present at work physically, but probably not mentally or productivity or physiologically there, is really important. It's something we need to look at. So rather than just focusing on absenteeism, we need to really, the research has shown we really need to look at presenteeism to make sure that people are happy to be at work, but also productive as well. And mental health problems, you know, I've been in mental health a long time, and I've noticed the focus on mental health has increased tremendously. We've got so much work to do, because if we don't tackle mental health issues in the workplace and in wider society, it will continue to cost the GDP 5%, which is a hell of a lot of money. So although it's great that mental health is higher up the agenda, we've still got a lot of work to do to tackle mental health of our workforce if we're going to make them more productive. Yeah, and this is probably the last slide. So the NHS, where I work at the moment, we've got an overall sickness absence rate was 4.9%, which is, you know, a high number. And with one of the largest reasons being anxiety, stress, depression, and other mental health related illnesses. So sorry, I'm bombarding you with lots of stats, but I can see I'm quite keen on them, just to show the impact that we really need to tackle the mental health of your workforce if we want to make them productive. And yeah, because it is part of the retention policy. But yeah, the stats speak for themselves, but they're quite large, worrying statistics. Yeah, next slide, please. So I think this is probably my last slide. There was a couple of research about what can we do to retain our workforce. And these are quite simple ideas, but the research has shown that it actually helped with retention. Why not give your staff the day off on their birthday? It's easier to do in some organisations than others. Making welfare calls to staff, actually phone them up and chat to them. You know, it's up to you how you work with staff, but making that positive discussion. And if there are mental health issues underlying or problems at home or to do with family or childcare, actually make those calls. And we'd like to think as managers that we do that, but maybe we don't. Sending out thank you cards. I know lots of organisations have sort of annual events promoting staff and the good work they do, but why not do it on a more regular basis? I have seen organisations that do that. Just a little thing like buying a card and sharing that and providing positive feedback can make a big difference. Group supervision, when we're busy at work, first thing that goes out the window is often supervision and one-to-one time, but having not only one-to-one supervision, but group supervision. So, you know, peer support, as we know, is incredibly important, and research has shown that that works. As I say, providing good mental health support and the variety of methods to do that. For those of you who work sort of 24/7, our night staff, have a right to have meetings, and they may feel have to night duty, they want to rush off home, but it's really important to have that they get the same support as anyone doing a day shift. And yeah, as managers, it's easier said than done, but an open door policy where people can come in and talk to you before things escalate, so that if there are issues at work, stop them going off sick or having issues of presenteeism, if you can have an open door policy. And I know this sounds very easy to do, but research has shown that this has worked, because what you always have to think at the back of your mind is doing recruitment, and all the things that to do recruitment and managing new staff is also hard work and time consuming. So the idea is to do some, you know, upfront work to stop. Always have the back of your mind that while you're doing this, at least, and you're retaining staff, at least you're not having to do all the work that's involved in in recruitment, which, as we know, is very time consuming. I think that's probably the end of my slides. Because I was conscious of times and I do talk fast, but and it's very early in the morning. So I'll stop talking now. But I say I'm a great believer in apprenticeship schemes. I've had people with PhDs want to do the apprenticeship schemes. I think they need to do more to get the apprenticeship scheme is 36 months for a social worker. We need to think of a way of doing fast track like we do with the Think Ahead programme, so that we can get our most people who really want to come into the career but don't want to commit to 36 months of training to become a social worker when they've got a degree already through the apprenticeship. But yeah, I will stop talking now, but thank you.
Brilliant. Thank you for that, Elaine. That was really insightful. And again to Simon as well. Both taking time out of your day to, do this of no charge, and you're very busy people, so I do appreciate that. We all do. Now to move on to the Q&A section, we're quite mindful that it is getting closer to 9 o'clock, and some of you may need to leave, which is absolutely fine. For those that would like to stay, please feel free to. What we're going to do, if you can all see that the reactions bit at the bottom of the screen there, if you'd like to raise your hand, and then we'll go to you directly to ask your question. Now I can see that some have already came into the chat, so please raise your hand if you've put a question in there that you'd like answered now. Otherwise, what we can do, we can take those away and bring it to the next forum in the follow-up, because I'm aware that some of you may have asked questions but may not be here for the answer. Brilliant. Lovely. And yes, Harpreet.
Yeah, sorry, I had some technical issues and I missed the first part of the meeting, so I don't know whether this was covered actually, but I think one of the areas around workforce, which is really important and we kind of miss, and one of the opportunities is around asylum seekers and refugees. So we have a very big and significant asylum seeker and refugee sort of workforce that is in this country. Some of them, with the refugees in particular, they are allowed to work. Some of them are very highly qualified doctors, practitioners, etc., and could really sort of bring something into our, kind of help us to close that gap a little bit. So I don't know whether that was kind of discussed, but it's just a comment really. Yeah, sorry, I missed the first part of the meeting.
Yeah. I mean, one of the stats Nearly put in was the number of you're allowed to claim. Don't know all the technical term, but it's on people in the care industry are allowed to apply for a visa, aren't they? And that number is really increasing. I'm not saying that's the same category, but yes, I totally agree. If there's a way of capturing, as I say, on the apprenticeship scheme, we've had people from all over the world that have joined us on quite low graded staff in the NHS who are really keen to promote their career and being very highly qualified. Yeah, we need to attract them in, but also when they're there, make use of their and try and train them up and promote their services. Yeah.
Can I just say as well? So sorry, I've got a thumb up instead of a. I think it's a really interesting point, because a lot of places now are looking at quite significant overseas recruitment. A place I was working in recently was recruiting in South Africa, recruited 30 children's social workers for a small local authority in the Humber region. So that involved obviously going out, doing the recruitment, settling people in, moving, because it's not just about providing accommodation for those people, it's their families, it's schools, it's people then feeling part of the community and so on as well. I do think we have to think ethically about if we are taking, if we're going to countries that are in need of that health and social care infrastructure, and we're effectively taking people out of that infrastructure to the UK, if that makes sense. So I think your point's really interesting about people that are eligible to work whilst they're waiting for their asylum application. And I think that's something that would be worth exploring a bit more. alongside, I think overseas workers have always been a key part of health and social care, and I don't think we should forget that. But I think your point, particularly about asylum seekers, I think it will be interesting to explore a bit more for those people that are eligible to work.
Yeah, and can I just come into one more point on that? So, I mean, when I was working in Sussex, we did quite a lot of work around that and how to kind of remove some of the bureaucracy and red tape around it. I mean, as an example, we had somebody who was working as a parking attendant, because obviously people need work. And in conversation with him, we realized that he's a surgeon. And there are so many people like that. There are so many people that are like consultants, surgeons, practitioners, OTs, radiologists, etc., that are just working either in ASDA or as parking attendants or doing some work because they need to work. And actually, we've got so many, and what we've got is just some red tape around the registration process. So we were looking at how we can actually work with them and support them with the cost for kind of registering them and training them and going through that kind of transfer of their qualifications, which is, it's not a massive task. But if we did that, actually, we probably may not be able to. I mean, obviously, we will need to go overseas, but we've got a pool of people here who understand the language, they speak English, they're doing other work, which they really don't need to be doing if we just tapped into that. Thank you.
Absolutely, yeah, I agree. From my days as well, as managing a nursing home, we'd had highly skilled individuals coming in all the time, and it is a shame to see those skills wasted. So yeah, it's definitely worth something worth exploring. Simon, we'll move on to you next.
Morning, everyone. I'm Simon Lawrence. I work at Frimley ICB, head of workforce programs there, but have also worked extensively in adult social care, doing program transformation for 5-year blocks of transformation programs. Are really fascinating. That last bit really resonated with me, having done a lot of recruitment for vaccinators and struggling to get people across who were living in this country who had the right skills that we needed. So really, really pertinent, and really brought it back to me. I was interested to understand Simon and Elaine's views about the role of provider collaboratives within the NHS framework. There's a real opportunity, I think, there to look at how, whilst the focus is obviously about NHS trust, it does also extend into non-NHS providers and voluntary organisations, and I would extend that into care providers as well, around the whole cultural change piece. I mean, I think there's so much about really trying to engage within that market and looking at how we can affect better change, reduce the turnover that we know that happens. It's so wasteful between organisations. I'm curious to kind of press on that point as a real fundamental pillar to starting to tackle some of these issues.
I suppose my only comment is, it's, if you want to keep I think retention is incredibly important, and staff feeling valued and getting supervision. So we can do a lot of work about getting the numbers in and working collaboratively. But I'm a great believer in, you have to think for your own experience. When are you the most happy at work? When you feel valued and supported, no matter what level you are. So yeah, there's no denying that we need to work collaboratively with other providers, but really keep going back to the fundamentals of keeping the staff we've got. And if you've got staff that are have got some skills that are not being utilised, what can we do through training or recruitment and promotion to make that happen? So I haven't answered your question, but as you were speaking, I'm just thinking we need to focus on that, but we need really to focus on keeping our staff and avoid presenteeism and it's mental health is it's amazing how it's a lot higher up the agenda, but as managers, what are we actually doing to reduce that amongst our staff and stress and everything? And so I haven't answered the question. Whether Simon can, I'm not sure.
So Simon, you mean the provider collaboratives that are working across the integrated care systems?
Yeah.
So I've seen a really I think they're good because collaboration has to be the way forward, and collaboration across the healthcare and support system has to be the way forward. I think there needs to be that mutual understanding of pressures across the system. So I think if, for example, NHS colleagues in trusts are purely thinking about getting people out of the front door, and only think about social care in that way, then you tend to end up sort of bumping up against each other, because you've got competing pressures across the system. But I think where I've seen it work really well is where people take time to understand the pressures across the whole system, from example, from the point before somebody goes into hospital all the way through to them coming home and what happens after that, and then looking at actually what workforce is needed across that pathway. And I've seen the good collaborative work in the Yorkshire and Humber region, where workforce collaborative, where they then had subgroups looking at each part of that workforce and coming together, and the social care workforce, and also building in that approach to a more integrated social care workforce, as in the care provider workforce, was a key part of that. So I think if there's a shared understanding of the mutual pressures across the system in terms of the workforce that we're trying to build, I think they've got a really important part to play. And I also think it's really important for social care to be engaged and interested in things like the primary care collaboratives, and obviously should already be engaged in mental health collaboratives and so on, but things like primary care collaboratives, because local primary care and the workforce around that, I think, is the future of integration on a local level for people. So I think they've got an important role to play, but I think time's needed to set up the relationships, the trust and expectations of those.
Yeah, I think I'd agree. I think there's a real opportunity, maybe a hybridized form of a provider collaborative. You know, the care market is so fragmented. I think the NHS fails to understand how diverse it is, but also the problems that it has, the care market, where you have, you know, a registered manager, deputy in a small care home with very insufficient capacity resources, not through any fault of their own. It's just business model, very small. And that if we were able to strengthen how they work together collaboratively, and that's problematic because it's a competitive market in a sense, but if we were to understand how we can pull together to resource and understand each other's challenges, I'm sure there are some really rich nuggets of development that could happen within that sector. I'm positive about it. And having worked both sides of the fence and seen some of the issues, I think the first issue is going to be engagement, though. I think that, you know, the competition that's dragged around over many years, and the misunderstanding from the NHS and vice versa, but mainly NHS not understanding care markets and care systems, I think have to be really overcome with to begin with. And I think that's why, you know, place-based collaboration is going to really be an important part of that jigsaw puzzle.
Sorry, no, I was talking about a different type of collaborative. I was talking about the ICB, ICS collaborative. So I see what you mean now. The collaboration is really important. My experience has been that working, lots of places will have like a care home organisation that it's easy, you know, you can work with. I do think some of the smaller care homes are going to really have a tough time. Particularly if they're providing what I would describe as kind of basic residential, so the more traditional residential, where local authorities are looking to support people to live in their own homes for longer. But for me, you know, the key thing is to have those face-to-face discussions with providers, those kind of honest discussions about what's real for you. And you know, we can still follow the procurement rules, competition rules, and have those formative discussions, those regular forum discussions. For me, as a DAF, it was very important to speak to providers directly, and also to be really honest about the type of market we needed, and actually, you know, what the knows by that actually, you know, not all of them were going to be. If they're going to continue providing what they're providing, they wouldn't all be there in a few years' time. And I know that sounds quite blunt, but actually that message was actually really welcomed rather than sort of, you know, shilly-shallying around the edges of it. Yeah.
Brilliant, lovely. So do we have any more questions at all? I'm quite aware that we're 10 minutes past 9 o'clock, and I'm sure a lot of you have got busy days to get to. If we don't, that's great. We can wrap up there. What we're going to do, we're going to send the recording to everyone who's attended today. So should any points be missed, you'll be able to receive that, and we'll also put it on our website as well, which is Panoramic Associates. So we'll send a link to that as a follow-up to all of your email addresses that you've signed up with. And once again, I just wanted to say a massive thank you to Simon and Elaine. I think I speak for everyone here when, you know, I can say that, you know, you've really delivered on what we asked of you, and thank you again, really, just for taking the time out of your day to do so and start this conversation and start the breakfast briefing series. So really looking forward to the next one. More information will come out in due course as when we plan for that, and as well as that, we'll send some feedback forms out for all of you to complete about what went well in the session, what you think we could do better to host. But yeah, thank you to everyone that's attended as well. For any follow-up questions, please feel free to drop any of us an email. All of our contact details will be in the follow-up. And yeah, I hope you'll have a brilliant day.